And right about now, we are going to be talking about a very important thing when it comes to men's health, and that's the prostate. Often but not, people tend to not have these conversations. I don't know why. It is pretty much overlooked, but believe you me, it is very important and significant that we talk about it. Today, joining us in the studio this morning to have the conversation with us is going to be Dr. Kelvin Owusu, wellness consultant from Violet Medical Center. He's not a new person in this house. I mean, he's our very own. So, Doc, good morning.
Good morning.
How are you?
I'm very well, very
Doc,
well.
Yesterday morning,
I know,
yeah.
I was here yesterday.
You partied hard.
Yeah, and then now you're here.
I know, to talk health.
Yeah.
Of course.
So, Doc, obviously, yeah, we're talking about the prostate.
Yes.
Now, a lot of us, especially we the women, we don't know what the prostate gland is. We don't know the role. Please, can you tell us what the role and function of the prostate gland is in the male reproductive system? I really don't know what it is, so, honestly.
Okay, so the male reproductive system is made up of the testicles, then it connects to a certain tube which carries the semen or the sperm. Sorry, the testicles produce the sperms, and then those sperms pass through a certain tube through the prostate gland. And when it gets to the prostate gland, the prostate secretes some fluids which nourish the sperm. So those fluids come together to form semen. So semen is made up of sperm plus prostatic secretions, and there are other secretions from the seminal vesicles and other places, and then comes out through the urethra, right, into the, wherever it's going to end up. So the prostate gland plays an essential role in fertility of men. Because without semen, okay, so you may be aware that the environment of the vagina is acidic, and it's acidic for a good reason, because it has to maintain.
Is it a pH level?
The pH level has to be low so that bacteria cannot invade the vagina. So the role of semen, semen is alkaline or basic. So semen
women is acidic and the man is alkaline.
Exactly. So the semen neutralizes the vaginal environment so that the sperm does not get killed by the acid in the vagina. So semen is very important, and so the prostate plays a key role in this regard. Now, if you look at where the prostate is, it's located right under the bladder. You see?
Right under the bladder?
Yes, right under the bladder.
Okay.
Just in front of the rectum.
Wow.
So the rectum is behind the bladder and the prostate. So this is why that close relation between the bladder and the prostate. That's why when men have prostate issues, the common symptoms tend to be urine related.
Yes.
So they struggle with urination because of where the prostate is sitting. In fact, the urethra, which carries urine from the bladder to the outside, passes right through the prostate gland. So literally that's the relationship. The urethra is passing through the prostate. So when there's any problem with the prostate, it affects the urethra, and then you have problems with urinating.
I never knew that.
Yeah,
I just hear about prostate, but I never knew it had to do with urinating.
It does affect the urination. I mean, if a man's prostate starts acting up, I mean, you can probably see him crawling on the floor because of the discomfort.
Is it painful?
It is terribly, terribly painful. I've actually seen a man rolling on the floor because of a prostate problem.
I'm sure it's going to be more than menstrual cramps, huh?
Well, I mean, in the sense that menstrual cramps are, regular or repeated, it doesn't compare in that regard. But the pain at that particular time, yes, because picture this: you feel like urinating, you have the urge to urinate, you go and stand by the potty or the toilet, and the urine is not coming out. So you can imagine when you are in a trotro or you are driving and you feel like urinating, and even that one you can urinate, but because the environment is not conducive, you are holding it. See how you start sweating. So imagine now you actually want to pee. We've gone to the place to pee, and then the pee is not coming. That is acute urine retention because of the prostate enlargement. And then related to that would be recurrent urination. Sometimes you feel like urinating, you go and stand by the urinal, and just small urine will come. Then you go back to sleep or whatever, and then a few seconds or a few minutes later,
you have the urge to urinate
again. It's like a UTI.
It's actually more annoying than a UTI. Because imagine waking up to urinate 10 times in a night.
That's distorting your sleep completely.
Exactly, you wake up in the morning and you are tired, you cannot function, you're not productive because you are half asleep. That is how disruptive a prostate problem can be.
Wow, Doc, at what age should a man go check their prostate?
Okay, so now the standard guideline is that once you are 40, you need to go and have your prostate evaluated. However, it also depends on your personal history or your family history. If you come from a family where your brother, your father, and uncle has had prostate issues before, you need to start paying attention to your prostate earlier. You see, but you see, men now, they are just stubborn. I don't know what it is with men. I mean, in my practice, most of the men that actually come to the hospital for any form of checkup is somebody that push them out of the house and say, go to the hospital. So men generally don't come to hospital willingly, you see, and that's part of the reason why we kind of miss a lot of these prostate issues. Fact number one, every man will have their prostate enlarged as they grow older. However, it's not every prostate enlargement that will cause problems. You know, so if you are not checking your prostate, I mean, you are probably living a bit on the dangerous side of life.
So it's like women going to the gynecologist, basically.
I mean, women would go to the gynecologist for the smallest of symptoms. Men,
Chris.
no, unless the man is, unless he's on the floor, he's not. Even when he's on the floor, he will tell you that he's not sick.
You know,
he's
take
just resting.
Right.
You know, so it makes it a bit of a
But
challenge.
there's something a bit confusing for me. You understand? I've heard some men say, okay, if you want to go check your prostate, you have to, you know, it's all the way down there.
Yes, it is.
Yeah, but since it's the bladder, how is it now down there? Why is the test down in the anus?
Well, remember, so that's why when I started, I mentioned that it's right in front of the rectum, you see.
Yeah.
So now, where the prostate, okay, so if you came to me and I'm doing a physical examination, you know, I press your abdomen to try and see what I can find. So I can find the liver, I can find the spleen, I can find various organs. But you cannot feel the prostate from the front or from the top, you know. So you have to go inside where it is. So that is why the prostate examination is done through the anus.
Do you think that's why people don't come for the test?
No, but here's the thing. Women, in quotes, women suffer a lot more invasive examination than men do.
Very, very invasive.
Exactly.
That's true.
You can have two people looking directly inside you, and
exactly.
you're like, okay, what's going on?
but you ladies still go to the hospital.
Yeah.
So it's just one examination, and the men are running away. And this examination is life-saving. You see, there's this misconception, or there's a lot of people are going about and doing the PSA. The prostate-specific antigen, which is a blood test to try and assess the prostate. Now, the interesting thing about the prostate is that there are different parts of the gland. Not all the parts of the gland produce PSA. So in other words, if your PSA is normal, it does not mean your prostate gland is normal. It just means that the part of the prostate that produces PSA is normal. So you can
So that means it's not fully effective.
Exactly. So a proper prostate assessment is a physical examination, i.e., a finger up your butt to find out what's happening with the prostate, and a lab test. And on top of that, you even have to do an ultrasound scan so that we can assess the prostate fully. And so there are men who are working about today who've done the PSA for years and it's been normal. And then something happens and they go to the hospital, and then somebody finally does a proper assessment and they realize that they have prostate cancer.
Wow.
You see? So just doing the lab test is not enough. You need to do all the three.
Right. So
The physical examination, the lab test, and an ultrasound scan to fully assess the prostate gland. Then we can say that you have a clean bill of health. Otherwise, you are just, you've done like only 30% of the examination, which is obviously not even a pass mark anywhere in the world.
all right. So talking about prostate cancer, what is the primary risk factor to developing the prostate cancer?
Well, when you put it that way, the primary risk factor is the fact that you have a prostate. So men are the only ones who are at risk of prostate cancer. Then number two is age. So the older you get, the more likely you are to develop prostate cancer.
Right.
Then we have, lifestyle. Are you eating a lot of fatty foods? Are you taking a lot, so fatty food, junk food? Are you exercising? Are you smoking? Are you drinking alcohol? All these are lifestyle factors that can predispose you to develop prostate cancer.
I feel like we should just be drinking water.
Yeah, because every time we have these health
I feel like everything
conversations,
should just be...
one running through thing is lifestyle, what you're eating, what you're drinking, exercise.
And right now in Ghana, as you may be aware, we are dealing with a double burden of disease. you know, where we are still battling with the infectious disease, and now the lifestyle diseases have also come to join. So if you are not taking care of ourselves, we are really at risk of a lot of these things. You see, and exercise cannot be overemphasized. It affects, it improves everything. So you see, if you know that you enjoy drinking alcohol, you shouldn't wait to be told that you need to
exercise a lot
more
if you want to enjoy it.
Exactly. If you enjoy eating junk food, again, nobody should tell you that you have to combat that with a lot of exercise.
You have to shred,
Exactly. But if you left all those things, then your risk of all of these things increase. Now, of course, there's this, I'm sure you're going to ask, let me just put it out there. There's this thing about having sex and prostate cancer. Now, so I'm sure they may not be happy with me, but the reality is that it's not been proven that if you have more sex, your risk of prostate problems go down. It's not been categorically proven, you know. And so, I mean, if you want to have sex, by all means have sex, you know, but it's not because of prostate health that you are going to have sex, because there are so many other things that can help improve your chances of preventing cancer than just having sex. Because if you're having sex and you are drinking alcohol and you're smoking, it's counterproductive, you see. So prostate health is very, very important, and it's something that as men we need to pay attention to. And like I said, every man will have his prostate enlarged as he grows older. But not every man will have prostate problems from the enlargement, you know. Now, I've mentioned some of the symptoms already, but let me just touch on again. So the most obvious symptoms usually tend to affect urination. So you tend to have frequent, small volume urination. So now the emphasis on the small volume urination is because diabetes also has some urinary symptoms, but diabetic symptoms tend to be more voluminous. So you go and urinate more volume more frequently.
Sugar urination.
Exactly. The prostate urination tends to be smaller volume more frequently. You know, so you feel the urge to urinate, you go and stand there and a small will come. And you move and then you go again, a small will come. So it can be very, very disruptive. Then you can also have blood in your urine. It's called hematuria. You know, and usually if you do have hematuria, then you are leaning more closer to cancer. You know, even though yes, the benign prostatic hyperplasia, that's BPH, can also cause hematuria, but most of the time hematuria we treat it a bit more aggressive because that's most likely.
So the BPH, does it have a tumor in it?
So the whole that's when the whole prostate is enlarging. That's the BPH. It's called benign prostatic hyperplasia. So that's not a specific tumor. It's the whole prostate that is kind of getting bigger. You know. Then if it is indeed cancer, you could start developing low back pain. We don't actually want you to get to that point, because at that point it means that the cancer is spreading to your spine. And so we don't want you to actually get to that point before you come to the hospital. We want you to come now and get yourself evaluated, so that if it is indeed cancer, we can deal with it immediately.
Doc, before we let you go, what is a quick advice you can give to the men, one who may be suffering from prostate issues, or one to, caution them so they don't even get there, like if it's likely?
Okay, so now the first thing is, like I said, regular routine checkups. You should be checking your prostate. Once you hit 40, you should be checking your prostate at least once every year. So you need to get that done as regularly as possible so that we know how your prostate is progressing. And then if indeed you have a prostate problem and then there's a treatment plan that has been provided for you, please follow it. Because here's the thing, some men have gone to the hospital, they've actually been given a treatment plan, then they go and meet somebody in the trotro or in some herbal facility and they say that they can cure your prostate without whatever, and then they go follow that person.
They give you herbs.
Exactly. And then the end result is chaos. We as doctors, we don't have any problem necessarily with herbs. It's with the wrong application of those herbs and the fact that they try to make it seem as if it's better than the orthodox medicine that we are using. If it's so-called, it's better, as you say, then provide research to back it, and that's all. You know, it's not about word of mouth. So once you are given a treatment regime, please follow it so that we can save your life, because that's what we all want to achieve at the end of the day. We want to save your life. You know.
Yes, Doc, thank you so much for speaking with us. Now, how can people reach out to you in case they want to come see you for examinations and treatment?
Well, I'm quite active on social media, Kelvin Owusu MD on all channels, and you can also find our clinic as well, Violet Medical Center, on all social media channels, and then you can come through.
All right,
it's been great having you on the show. Such insightful conversation.
Thank you
all
for
right,
having me.
ladies and gentlemen, you've heard it from the doctor. You need to go and check your prostate. That's for the men, and the women. Please push your husbands, your brothers, your your
Uncles.
uncles, they should go and check it. Don't wait until something happens, or don't go to the church and then you take some edro and say, okay. Yeah, so please, just go and check yourself, okay, before anything gets worse.